had an issue with my sinuses. I had a sinus infection. Unfortunately, I have bad allergies, chronic sinus infections. Called up for some sinus medicine, and I was shocked when they said, "You don't understand. We're not your doctor anymore. You have to go elsewhere. Your medical needs are so sophisticated. You need to go elsewhere."
That and the endocrinologist that I first went to, who was like, "Nobody in this state will treat your condition." Like, that was what he told me, and like was very, very rude, and like wouldn't, like, stood on the other side of the room from me, like would not come near me as soon as he knew that I was trans, and like asked me gross questions like, "Have you had the surgery?" There's not a the surgery, you know, like that's a terrible thing to say. And like, I felt so awful. Like, I'm sitting there in a hospital gown with this dude who won't even come near me.
It starts very early in the age for most patients who are marginalized. This is, in America, this is the underserved population, so most of the patients, they do struggle financially. On the top of that, when you prescribe these medications, insurances don't cover it, so most of the payment is, out of pocket. So that's another burden, and it's not cheap. So we're talking about, in some cases, it could be $100 or $200 every other week.
It's kind of like if you had a tumor, which is the best way I can describe it, that was visible, but clothing normally covered, okay? But you knew you wanted it off your body, because that's the way it feels. I have no benefit from having breast at all. I hate the jiggle. To run, I'd have to put on a really tight binder. When I practice choreography, I have to put on a really tight binder because feeling the jiggle of breast drives me absolutely crazy. It's a constant reminder that I am not who I want to be.